Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome to the Consult Before the Cut. I'm Brittany DeSherry, and today I have with me Taylor
Besh. I'm so excited to be with Brittany today. Dr. Weiler is out, so we get to dive deeper in a amazing topic that honestly doesn't involve him because he's not going through this stage of life that we are experiencing. So I feel like this is perfect to have the ladies in the house.
Yes. And we
Tell us what we're talking about.
Here it is. Hormones gone wild.
Hormones.
Estrogen dominance.
So I feel like this topic is talking directly to me. I am 40 and perimenopausal. And so I am so passionate about this because all of my friend group, we're all experiencing the same stage of life. So diving deeper, yes, estrogen dominance. What is your take?
So I think estrogen dominance is a lot more talked about now. Obviously not like, I don't think we're in the group text going, hey, I have estrogen dominance, but It's like all the symptoms and everything that are associated with it and kind of what it is just on a surface level. Estrogen dominance is when you have too much estrogen in correlation with your progesterone. So with your other hormones.
Right.
So you have your, it's not just that you have a whole bunch of it. It's just that you have so much more than your progesterone. And so then you start getting into all of these side effects and things. This is where the group chat comes in, where it's like,
hey, nobody's saying, oh my gosh, I have a high estrogen.
Yeah, it's like
they're complaining of, I'm fat, I get headaches, I'm stressed, I have anxiety,
just
hair's falling out,
no libido whatsoever. Yes. My boobs are sore, like all these things that are coming about. And I do believe, and I'm so happy. I think that in the past few years, menopause has just been talked about so much more. It's kind of like been taken out of the shadows and it's like, it's here and we're going to talk about it. And women don't have to do that. Yes.
More so now and talked about more so. We're not shamed.
No. Ma'am, sit back in the corner. Use this menopause. Like it's fine.
Men can talk about testosterone and their experiences, and we have been overshadowed, but here we are.
No.
Estrogen dominance is real. It's part of the menopause process. And I would say, kind of to add to what you said, yes, your estrogen gets higher, but it's not necessarily getting higher because all of our hormones are starting to kind of crash down.
Yes.
It is not necessarily getting higher. It's just that you're losing your progesterone production more rapidly than your estrogen. So
and then
that's
you have
whenever
this big bad estrogen monster in there just doing all the things wreaking havoc.
Yes. So, causes of estrogen dominance, and we'll get a little bit into this, but there's things that you can help and that you can't help, and we'll bring Rosalind in a little while to kind of dive deeper, but you can't help age.
No.
You can't help genetics.
We're all doing it together.
We are fighting a battle that unfortunately we cannot control. And so there are some things that we can alter and adjust, but unfortunately we're all headed there, Yeah.
And just like you said, some like genetics, like why this is taking place and everything. Yes, you do have some things that are environmental or some things that, disease process, but most of the time we're just aging and it is what it is. I am very happy to, we are going to have Rosalind, one of our nurse practitioners over at Rejuvime, so when I started back in Rejuvime, I was 2018, I started, and when I started working there, we were about, I'd say 80-20 guys.
Men to women.
80-20. We kind of went through like a transition period and we got a new nurse practitioner, and then we started hiring some female nurse practitioners that came in, and now we are all, we have nothing but female nurse practitioners. Just with that, we have increased our female population that we see to probably 60-40. Like, it's wild that we are now seeing more women than we are men, because I think we went through this huge.
Oh wait, 60 is female.
Female.
Ah,
no.
wow.
I'm 60 is
because Rejuvime started a long time ago as
Yeah.
a testosterone clinic, pretty much.
Yeah.
You know, and wow, that's
and
impressive.
So all of our nurse practitioners, and I really do think a guy will talk to anyone under the sun about anything that's going on. It doesn't matter. They're just going to lay it all out on the line. This is what it is. And I think with women, it opened up more of a conversation, having another female to discuss these changes that they're going through with. Because this is a journey. I mean, this is something, when we go perimenopausal, menopausal, and then we're postmenopausal, this is some years.
Yeah.
This is going to start in your
I know,
mid-30s.
it's such a vague time frame that you have, that it could be 10 years of going through this before you're truly in menopause.
Yes.
And so you're just supposed to meander in those 10 years and think it's all fine.
Just ride that roller coaster.
Yeah.
Just riding the roller coaster every motion.
I think Rejuvime is a blessing to a lot of people, because patients are told from their physicians that you're fine. You're good. You're good. Go ahead, live with it. And so Rejuvime can kind of dive a little bit deeper and see what truly is going on. And obviously, a lot of physicians do that, but some old school docs don't. They just, want you to go through life and think all's good.
Yeah. And the thing, the way healthcare has come over the years, doctors are required to see so many patients in such a small amount of time. And something like this takes time to sit down and talk through. Yeah. We have made amazing relationships with a lot of the GYNs in town who, because it is so time consuming, they're like, this is what you're going through. Go see the girls over there. They can sit down with you. They can talk. Yes, they have the time to deal with it, because it's a journey of tweaking. So like, you go in, you'll, go through everything with the nurse practitioners. They put you on something. You're doing great. Everything's good to go. But because you're in that perimenopausal state, you're still on a roller coaster.
Right.
So, as soon as you start like, okay, this isn't working anymore, you can go back, talk to them, tell them, have that somebody that you can go to and ride this roller coaster with, because it is definitely an up and down thing.
Right. So I want to start from ground up whenever we talk to Rosalind about how patients are presenting to her. I know, personally what I'm going through and what I'm experiencing, but what, a normal patient is coming in explaining. And this may talk directly to you, and we can kind of show you the process of how to get the ball rolling, what to do, how to do it.
Yeah. And it's like, with estrogen dominance, another thing, a lot of people, when we start talking about like the causes and all this kind of stuff, a lot of the medicines that we're taking, birth control, like bad hormonal birth control, like absolutely.
Plastic.
Girls are going in. There you go.
Plastic's
Don't worry. Like I said, you can get on TikTok and cure estrogen dominance with cabbage and Brussels sprouts. Like, these are things that we can do. But I was like, I promise. I was like, TikTok said I could do it. But all these different medicines that we're getting put on now. When you go to the doctor, when you're in your younger, kind of like in your 30s, you go to the doctor, I'm having kind of like irregular periods. I kind of just don't feel good. They'll put you on a hormonal birth control to make your periods regular. And it's like, okay, no, that's not what we're doing. We're literally just like skimming the surface on some symptoms to see if we can kind of get them to what you want. But we're not diving deep into it.
Anything, kind of masking it. And one thing, sometimes hormones have a bad rap, or people are scared. But the antidote to that is living in an estrogen dominant state is also harmful.
Yeah.
So that is not a good, healthy way to live either, because, kind of medical, but you're thickening that uterine lining, and then nothing there is there to slough it off.
Yep.
So that's where the irregular periods come in. But you don't want to thicken uterine lining, because that can lead to, the C word and things like that. So it's kind of double-edged.
I think a lot of people don't realize either how important estrogen is in all aspects of our body. I mean, estrogen is used throughout our entire body by all of our different like big organs, cardiovascular wise. Like, these are things that,
bones,
bones. It just kind of, I think that kind of everybody just thinks like, oh, estrogen, female. And what's wild is,
let's talk about males.
What's wild is, no, it's not just female.
Yeah.
Guys also can have too much estrogen. And that's like a whole nother slew of issues, Then the men start, with, they'll have breast tenderness, weight gain, erectile dysfunction, all this kind of stuff. Gynecomastia.
Being a little more weepy than normal. They're like, what the hell's going on?
That Super Bowl commercial is going to hit them a little too hard. But no, so guys can have that too, which is why it's so important to make sure that someone with that knowledge that does that stuff is really checking in and making sure that all of your hormones are balanced.
Yeah.
I think it's absolutely amazing.
Let's bring in Rosalind.
All right. So we are going to take a quick break. We are going to bring in Miss Rosalind. She's one of the nurse practitioners over at Rejuvime Medical. So that's what we're going to head there next.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters. We all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
So my hair had started falling out about 8 months before I saw Holly at Rejuvime. I had seen my regular doctor and he told me everything was normal, but my hair was falling out, so I knew everything was not normal. When I went in to see Holly at Rejuvime, she gave me all the information that I needed and told me the benefits, how it would help. It's not brittle and frail anymore, and it looks much healthier. It's not just about what's going to happen today or tomorrow. It's about years forward.
Welcome back. Before we get started, I want to thank our sponsors, Rejuvime Medical, the Age-Defined Clinic. They are experts in all things hormone replacement, GLP-1 weight loss, and they do dabble in those aesthetic injectables as well. And then also Weiler Plastic Surgery Group, the largest plastic surgery group in the state of Louisiana.
Yes.
So from Rejuvime Medical, here we have Miss Rosalind Kinney. She is one of our nurse practitioners. Rosalind, thank you so much for coming out and talking to Taylor and I about this today.
Thank you for having me. I'm excited.
Tell us a little bit about you. She is nervous.
I am nervous.
And she's going to do great. We're putting her on the spot this morning,
That's
too
okay.
early in the morning.
That's okay.
Tell us a little bit about you, Rosalind.
Well, I born and raised in Baton Rouge. I went to ULL for my undergrad for
Love
nursing.
Lafayette. Gosh.
I loved it. Greatest experience ever. I was a registered nurse for about 10 years. Then I went back to school. I went to Southeastern to get my graduate degree. Graduated last May. And then I started at Rejuvime around October.
Awesome.
It's been fantastic. So grateful to be there. Loving the journey.
Love it.
Loving.
Can we
so
all
excited to be
appreciate
here.
her lips?
I know.
Hello. She's got the most beautiful lips ever.
Thank you. Thank you.
I'm trying to relax.
I'm telling you, look, we've got this.
You got this,
girl.
girl.
This is the great thing about this. This is something that you deal with all day,
Yes.
every day.
Yes.
And you are becoming that expert.
So let's dive a little deeper. Estrogen dominance. I know you've been listening to it, but what do your patients present to you as? What do they, obviously they're not telling you they have estrogen dominance, but give us their experience.
So typically that middle-aged female in that perimenopausal state, even menopausal, they come in with these symptoms. Mostly it's weight gain, specifically in that abdominal region, just carrying their weight differently. Mood swings, headaches, difficulty losing weight, breast tissues more dense, that fibrocystic breast tissue, and breast tenderness. And their moods are everywhere. They feel insane. They're like, look, this isn't me. 5 years ago, now I want to choke my husband. I have no patience, and I know it's not me. I want to feel better, so I want to see what my labs are looking like. What's the issue? Can you help me? Please help me. And we just take it from there.
Yeah.
We hone in on their symptoms, specifically what is bothering you the most, and kind of address that for sure. Get them feeling better. I express to them it is a journey. It's not a one thing's going to fix everything.
One-stop shop. Fix,
right.
Like get it done.
Right. So, and I tell them I'm with you this entire way. We're going to get you right. So very appreciative just of that.
Yeah. So other than age, obviously, what do you think are the leading factors specifically to estrogen dominance?
Leading, like you said, age, but now it's more environmental factors that are going on. I know you hear about BPA in plastic. That is a xenoestrogen. It increases your estrogen levels with exposure. Pesticides and parabens. I know you see on shampoos, paraben-free, all those things. So just being mindful of those
So all
factors.
those things make you make more estrogen, or they're acting as an estrogen?
Similar.
Okay.
I would say acting as an estrogen. Just the exposure to it increases your levels.
Yeah, okay.
In a sense, not to get too medical.
Yeah.
And
Obesity
yes,
is huge.
adipose tissue
Yeah.
converts your testosterone to estrogen, and it actually produces estrogen.
Yeah.
So being overweight, that's a big issue in America.
Yeah.
I mean, it just is what it is. Our food quality, lack of exercise.
I was going to say diet.
Diet.
Yeah.
Well, also, like, I know all of us, us three sitting at this table, we have more kids than us three sitting at this table.
Yeah,
Like,
right, yeah.
Our
Right.
kids outnumber us substantially
Yeah.
at this table. But stress.
Okay,
We
hello.
are
Cortisol.
we are moms running around, crazy ladies doing all the things, and
Yep.
just having that
Chronic
extra
stress
added-
level.
That
Yes.
is also going to add to
Yes,
this as
that
well.
cortisol is going to throw off your hormones, that imbalance. Estrogen dominance. We're talking when your estrogen, the amount of it is outweighing your progesterone, and you're just thrown off. You need a healthy balance of both, and that just tends to happen with time, age, and the factors that we just discussed, especially diet. Just obesity itself, people tend to overlook. Like, that has nothing to do with my hormones, that's
it's
going to
huge.
It has
yes,
a lot
it
to
is.
do
It's
with
such
them.
a large factor.
The funny part, if you do a quick Google search of these symptoms, it's like eat healthier, exercise, drink more water, and cut out plastics. Really? Unfortunately, that's amazing, but not going to get us where we need to be.
That's not gonna stop
Right.
the aging process.
Correct.
It's just not gonna.
Correct.
My ovaries are still going to just wither
Yes.
away in
And
there.
eat cabbage. Like Brittany said
Just
earlier.
Oh, God,
eat
the TikTok
cabbage.
trend.
I'm telling you, y'all, I have never seen so much, because I guess obviously just with our line of work, like my algorithm does a lot with that. The amount of people that are like, all you have to do is get this cabbage and boil this cabbage and do this, and it's gonna fix your estrogen dominance. I'm like, what? I'm like, this is
I'm
out
not
of control.
bashing cabbage. I like cabbage.
Huge fan.
Unfortunately-
Love a Brussels sprout.
Yeah.
Like,
Not
can't
gonna get you
enough.
there.
Right.
But it's not gonna get you.
So you're
what?
experiencing this. I'm experiencing this. My friends are experiencing this. What do you do? Like, I come and tell you this. Then what's your next step?
So when you come see me, you've already had your labs done.
Okay.
So we are going to go through your lab work, see where you are, see where that imbalance is, and try to correct it as much as we can, along with lifestyle modifications. We look to oral progesterone for women to kind of find that balance with your estrogen. And
So before we get to treatments, say that your lab work shows you have a higher or normal level of estrogen, right? And a lower level of progesterone.
Right.
That is what it's basically going to show
Yes,
you.
yes.
And so that's when you're like, ding, 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 this all matches estrogen
Right.
dominance.
And they're actually relieved. There is a cause, there's
Yeah.
a reason for why
Okay.
they're feeling that way. So when I see those two numbers are completely off, I know that's what's really going on there. Yes.
Okay. You were going to say something.
Yeah. So, but I will say this, like, not only the labs, obviously, because hormones and labs are they're a tricky.
Yes,
They're a
you
tricky
can
little
catch
thing.
them on a different
They-
day, and
it's
they're
like,
completely
if you were to come
different.
in 30 minutes later, it may have been different. So that's why it's so important for things such as estrogen dominance that we're talking about the symptoms and everything that is associated with it. And yes, maybe like on the second go around, we'll be able to get labs and get a little bit of a better picture. But that's what makes it difficult. So when doctors are just like, hey, your labs are good to go, like 2 thumbs up, keep on keeping on, it's like, wait, no, my
at the
labs could be
bigger picture.
completely different
Yes,
tomorrow. And so I think that's where, when we talk about like having the time to sit down and express the concerns with the symptoms is
Right.
so important.
Like, are
because
your periods regular?
No,
Are they
yeah,
irregular?
I like
what
that.
else is going on with this?
I don't even know a person that has a regular period.
Right. It's
Like,
so
it's
many
just-
pieces of a puzzle that we have to take into account when we're trying to figure out, because everybody's different. Every patient is different. You can't apply this treatment plan to everyone across the board. And I love how we have the time to sit down and adjust that personally to them. So.
Absolutely.
Okay, now go to treatment.
Okay. So we got it.
Yes.
So we obviously got it. What are we getting?
So we have oral progesterone to kind of help that balance. We're going to recommend, like, obviously cut back on drinking. Estrogen is metabolized through your liver. So if your liver's not working functionally, it's not going to be metabolized functionally.
And everyone in Louisiana needs to cut down on
You
drinking.
live in South Louisiana. Obviously, food, the things that you eat. Avoid processed foods. Avoid processed sugars. Exercise. Just be active. Move your body 3 to 5 times a week if you can.
That's the thing. It's like we can put you, we're going to put you on the medication to take you to the next step. There are some lifestyle changes that you can do as well to help benefit.
Increasing your fiber.
So one thing also, if you're a little like hesitant, you can start the weight loss journey with Rejuvime.
Yes.
Right.
You can do a GLP-1.
Absolutely.
You can start there, see if the weight is contributing to the estrogen dominance.
Right.
You can start working out. You can cut out plastic. You can eat better. You can, all those things. If it's not improving, progesterone orally.
Yes.
At night is the best option for true medical estrogen dominance. Now, why do you take progesterone at night? I'm sorry.
The biggest perk, these girls love it. You sleep like a baby.
Yes.
Another
sleep.
complaint, I don't sleep. Or I fall asleep, I wake up a million times a night. And they start this oral progesterone at night. And they call me and they're like, oh my God, I'm not sedated by any means, but I sleep solid. I wake up refreshed, and that itself is going to make you feel better.
Yeah, the progesterone sleep you will hear.
Yes, it's amazing. I hear that it is fantastic.
Yes.
But the good thing about, when we talk about oral progesterone and stuff like that, the great thing is over at Rejuvime, I know we have three, I think 3, maybe 2. I know we have like pellets as well.
Yeah.
Yes.
Oral, and then we have oral progesterone. Do we have a cream? Yeah,
we
have a cream as well.
So there's different options.
There's different options. And that is one of those things that it's going to be specific to that person and what they want to do and whatever, works best for them. But I will say I hear, the lovely things about pellets. You can just put it and forget it, and all that kind of stuff. But yeah, just having the options.
Later on in the menopause journey, everything is going to continue to decrease. So it may decrease uniformly where you're losing your estrogen and progesterone. And you may need a little estrogen. But speak on if you're on... So you don't only need progesterone when you're estrogen dominant. You're going to need progesterone if you're on estrogen.
Absolutely.
Because they have to balance each other.
Yes.
So if you have a uterus, you have to slough that lining.
Exactly.
So progesterone is going to be implemented throughout your menopause journey whenever you start to decrease.
Absolutely.
Yes.
So it's not just an estrogen dominant medication. Is
It's
what I was trying to
uterine
say.
protective.
Correct.
Yes.
So pretend like I live estrogen dominant and I am trying to eat cabbage and drink more water and move, and nothing is fixed. Talk about, long-term possible, hopefully not, but complications or health journey or health changes in a negative way that can happen. What happens
when you live in that estrogen
dominant state?
So it affects all of your organs, all of your systems. It puts you at risk for insulin resistance. So we're talking diabetes, and that comes with a whole list of comorbidities that leads to the cardiac issues. Estrogen is very cardiac protective. It's bone protective. When you get into that menopausal state, you lose that bone density. You're at risk for osteoporosis and all those things. So
another thing I was kind of uterine cancer.
Yes.
Which obviously nobody wants to talk about that, and hopefully that's not going to happen. But if you do have a low progesterone for long term,
fibroids,
endometriosis,
fibroids,
all
those, and you
can
hear
happen.
horror stories, but high levels of estrogen feed those fibroids. They get larger. You have those painful periods with clots. They're heavy, and then the endometriosis. If you already suffer from that, it only kind of makes it worse. It makes that tissue proliferate and grow. So
obviously we know that, GYNs and everybody that's seen this, there are some out there that will say, like, do not do hormone replacement.
Yes.
don't do it. Don't do it. They'll say don't do it because it'll cause cancer.
Right.
And I think that's where a huge misconception.
Lots of education needed on that topic.
Yes.
I probably 60% of our patients come in hesitant about hormones, like, oh no, I can't do that. I can't, my GYN said I can't do that. My PCP, my mom has cancer or had breast cancer. And you just have to sit down with them, make them feel comfortable, and kind of debunk that myth with knowledge.
Educate.
And,
I mean, education is power.
And education of, this is like, as a nurse, I'm like, there's nothing more that I want for the entire world to be preventative and not like reactive.
Yeah.
Yes.
And so like just preventative health care, get your mammograms, do your paps, do all of the things.
Yes.
And you know, those are important to keep up with. And
Absolutely.
you know, like, hey, I'm good. I can go ahead and do whatever hormone replacement that is suggested,
And-
you know.
And we're monitoring you.
Yes.
We ask you to stay up to date on your recommended screenings, which is all we can do. You know, we trust you to do your part. We do our part to make sure it's the most healthy and beneficial route for you.
Yes.
Yeah.
See, I love that. And y'all know me, I'm always saying that it is everything that we talk about here. It's a road trip. It's a journey. It's something that you're going to be doing forever.
Yes.
And it is, I mean, obviously hormones, and you know, we didn't even get into like, once we get to that menopausal state and we have zero things, zero things, we're going to need all the things. And so having somebody that can go along with you in that journey and moving forward with you and helping you tweak, because like you said, this could go on for over a decade.
Yes.
And
a roller coaster.
Yeah, a roller coaster until you can get to
Perimenopausal.
that like even state.
Yes.
So, you know, I think
So pretend like I came to see you. I'm estrogen dominant. I start on oral progesterone. How long does that normally take for me to see results or feel better?
I would say, and I'm very candid, give it a good 2-3 months. Yes.
Yeah.
I think that your sleep is going to improve very
Rapidly.
quicker than that.
Yeah.
But however, the other symptoms that you're experiencing, give it some time. I ask for patience, and usually they're very receptive to that, and those
And
results
set them
do
up for
come.
success. Right?
Yes.
Hopefully it happens sooner. But
Yes. Yes.
you're going to feel better at 3 months. Hopefully
Absolutely.
it's 6 weeks.
you just
Absolutely.
wait till you
And
get that
usually it
progesterone
is.
sleep.
Yeah.
It is.
Yeah.
I feel like, but I like to, you know, that's standard.
Yeah. Okay.
I love that.
Okay. So I think that everybody, you know, is probably like, oh my gosh, if you're 40 like me, we're speaking to you.
Yeah.
So what is this step? Pretend like I'm like, okay, which I do need to go get my lab work done.
Right.
What's the
You're
patient
the person,
do?
Taylor. You're
Yes.
like, ooh, I have this, but like probably not going to treat it for
Yes.
another 5
Right,
years.
right.
I need to get with it. I need to put myself first, not these children.
I know, like we're constantly
We
like, yeah, we'll
have
get
to.
around to it. We'll get
Yeah.
around to
Yeah,
it. But like,
yeah.
when should people start? So, like Taylor said, she's at that 40. It's happening. Everybody's talking about it.
Right.
When should we reach out? What is
Now.
that? Now.
Now, give us a call or just walk in, get your
Right.
labs done, and then they'll schedule a consult with one of the providers. We have a one-on-one time together. We talk about all of your labs, what they may mean for you, along with your symptoms. I like to treat the patient, not so much the numbers, obviously.
Yeah.
And we make a plan, and it's a concierge service for a reason. Open communication all the time. If you have an issue, our nursing team is fantastic. They get back to us very, very quickly, and we get back to you. There is no 1 to 2 business days. You know, we have time
Yep.
to talk to you and address your
Yeah.
concerns,
Yeah.
which I love. I love having that time with my patients.
Yes.
And they're very appreciative.
Yeah.
I can't say that enough.
Well,
So-
we're appreciative that you
I
came
know.
on.
Thank
We're
so happy
You did
you
great.
came.
You feel better?
I do feel
You
better.
did great.
I do feel better.
So yes, I mean, okay. So to wrap up on estrogen dominance, it is out there. Everyone is experiencing it. It is absolutely normal. It's up to you to get out there and make time for yourself. I
Yep.
know all of the mamas out there who are running around crazy with all their kids, but making time for yourself and reaching out to someone who can actually help you with this, it's going to be life-changing. And you'll get a good night's rest.
Yes,
Which
yes.
none of us
Amen.
have had.
Amen.
I love
Hallelujah.
that. I love that.
Which not one of us has had since we've birthed a child.
Yeah, you see
And
these bags under her. It's okay. Concealer.
So yes, please, always remember to take care of yourself and put those mamas out there first. That's why we have to do the The airplane thing. We have to
what?
put our oxygen on before we put the oxygen on the baby.
Oh gosh, yes.
Yeah.
Gotta save
You're
the
right.
mamas. No. But also before we get out of here, I do want to touch on the guys.
Yes,
the guys with estrogen dominance. We totally, Dr. Weiler's not here, so we just kicked the guys to the curb this week. But male estrogen dominance.
Yes.
So we have these patients who are men who are starting on testosterone and all this kind of stuff. But then obviously, like we said, everything goes hand in hand together.
They're married.
So
That's how I think.
that's it.
Testosterone and estrogen are married. Where one goes, the other will follow.
Yes.
So-
So our testosterone's coming up, and what else is coming up? The estrogen is right behind it.
Yes.
I have taken so many phone calls from men, like you said, that are calling me like, "Oh my gosh, I watched a commercial yesterday, and I started to like get choked up." I'm like,
Right.
"Oh, you need
Right.
some estrogen blockers."
Right,
Like,
right.
and then like we said, the gynecomastia, which can become a surgical, issue.
Yes, yes.
So,
we like
stuff
to
like that.
catch it early. We on our follow-up phone calls, we're asking them any nipple sensitivity, any mood swings, any bloating. Are you irrationally emotional? Are you having issues with weight gain?
Yeah,
Are
that
you,
water weight
Are
they'll
you not
pack it
building
on.
your lean muscle like you usually do? Those results in the gym that you were getting.
Erectile dysfunction.
Absolutely.
That'll be the first
That's
reason
the
that they're
telltale
calling.
sign.
They're like,
Yes,
"Hi,
yes.
something's wrong."
And then we look at their labs and their estrogen is elevated.
Yeah.
So quick fix, we have estrogen blockers. It's a little pill that they take once or twice a week. They're very open to it. I would say it's very common. If it doesn't happen in like the first 6 months, okay, that's normal. But eventually, that estrogen is gonna try and make its way up there.
Men are not put on progesterone.
No,
They're
No.
put on an estrogen
Estrogen
blocker.
Yes.
So in theory, females are like, why can't I just take an estrogen blocker? Because we need the estrogen.
Exactly.
Yes.
Right? We need a healthy level of progesterone to balance it, but men do not need that high level of
No.
estrogen.
Right.
So we block their estrogen. Females need it.
We need it.
Exactly.
That's why we're the more complicated.
Yes,
We're the
humans.
more complicated humans because
Yeah.
we need all the things.
Yep.
But yeah, I definitely wanted to dive on that because it can absolutely happen to
Yeah.
men as well.
I see it very often. Our overweight males that come in very obese, and you see that truncal obesity, and I'm like, I bet their estrogen's elevated. It is
Sure enough.
It is.
because that
There it is.
fat tissue, it's producing estrogen.
Yeah.
Their testosterone is tanked. It's converted to estrogen.
Yeah.
So weight loss for them for
Yeah.
sure.
Yeah.
I mean, and testosterone replacement,
Yeah.
but
Yes.
I kind of hone in on that because they're so clueless. When I don't have estrogen, oh yeah, you do. It's
Yeah.
high actually. So
That's great. Being able to
it.
educate, you know.
Yeah, it's one of those things that it's like guys are like, I don't have estrogen. Girls are like, well, I don't need tests. We're like, no, yeah, everyone
you
needs
do.
everything.
Yes.
Like everyone needs all the things.
in the right balance.
Yes.
Yeah.
In that
education,
that little
just being
finesse.
aware.
Yes. Well, thank you so much, Rosalind, for coming
Thank
and
you.
sharing
Thank
your
y'all for having
expertise
me.
on
Awesome.
the subject. We
appreciate it.
greatly appreciate it. And for everyone else that is listening or watching us today, don't forget to give us a follow. We're on all the platforms, on all the social media stuff. You can listen to us on Spotify, Apple, all the things. Remember to always stay curious, always stay inspired, and to always consult before you cut. Thanks. We'll see y'all next week.
Bye, guys.
Bye. Thank you.